Alrighty, we're going to go ahead and get started here. We're going to be talking tonight about get to a full screen here. Going to be talking tonight about the silent underlying conditions of irritable bowel syndrome. Alrighty, this is something that I think a lot of you have probably dealt with in the past, not really knowing what's going on. And we know that living with irritable bowel syndrome is a complex web of symptoms that's going to be affecting your daily life. So now, if you're here, you probably already know what it's like to live with IBS, whether it's through bloating, through constipation, running to the bathroom when you least expect it. And really, it can take over your day. But here's the deal, okay? IBS is usually not the whole story. It's kind of like smoke coming from a fire. You can see the smoke, but really what you need to be paying attention to is the fire underneath it, because that's what we need to be putting out. So tonight I'm going to walk you through some of the hidden things that go along with IBS and how knowing about them can change the way you think about your gut. So just a quick show of hands here. Feel free to comment below. But I wanted to see here uh, how many of you guys have ever been told uh, that everything looks normal, even though you knew that something was off? Just go ahead and drop a yes down in the comments and raise your hand, and we can continue on with that. So as we continue on here, go to the next slide here. So understand IBS beyond the symptoms, right? IBS is almost never something that stands alone. Studies show that most people with IBS also have something else going on, maybe a thyroid condition, maybe it's hormone conditions, maybe stress or food sensitivities are contributing to it. And that makes a lot of sense, right? Because your gut isn't just an island. It's not a solo organ that stands alone in your body. It's actually connected to your hormones, to your brain, to your immune system. And when one of those is off, it can show up in great deal in your digestion. And that's why sometimes changing your diet helps a little, but it really doesn't fix the whole thing because we're not looking at all the other moving parts. Okay, so we have to make sure that we are advocating for ourselves and understanding these possible connections, because then you know what better questions to ask your provider and to advocate for yourself when it comes to different testing that needs to get done. Okay, first organ that we're going to look at and its integration into the gut is going to be talking about the thyroid. So let's start there. I want you to think of it like a thermostat in your body. Okay, it controls your energy, your metabolism, and yes, it does your digestion too. And most of you guys would think of that because you quite often put together that, okay, I'm gaining weight, my metabolism must be slowing down. Is my thyroid working right? That's kind of one of those things that goes hand in hand with your digestion. And so it's not very much of a shock to actually hear that. But hypothyroid or a slow thyroid can actually slow down the intestinal movement of food through the intestinal tract. And so that can end up leading to constipation, can cause bloating, can cause heavy feeling in your gut after meals. If your thyroid is running fast or hyperthyroid, it can be the complete opposite. Okay, it can expedite the transit time of food through your digestive tract. So you end up having loose stools or diarrhea. And you also, because the food's not being uh, it's not staying in your gut as long, you have the chance of nutrient malabsorption because of that. And so your thyroid plays a big piece in the transit of food through your gut. Thyroid disorders can also, because there's such a stress response in correlation to your thyroid, that it can affect the gut bacteria as well as the intestinal permeability. And so we really want to make sure that we're paying attention to your thyroid. Something else is that Hashimoto's thyroiditis, which is a autoimmune thyroid that is associated with a low thyroid or a slow thyroid or hypothyroid is an autoimmune issue that often coexists with celiac disease. And up to 30% of people may actually have a thyroid problem hiding underneath their IBS issues. And unless you're really looking for it, it's very easily something that can be missed. And many times, your basic thyroid tests that your doctors run don't catch it because they're going to run a TSH, which is a thyroid stimulating hormone. It actually comes from your pituitary. And if that's off, then you get a reflex to maybe a T4, which is an inactive thyroid hormone. So really, we're not testing enough. They're not doing enough comprehensive testing on your thyroid to make sure that it is not part of it. So even if your thyroid is fine and your TSH looks normal, quite often you need to dig a little bit deeper to figure out what's going on because you can have a conversion disorder in your thyroid where the TSH isn't getting converted to T4 and then to T3, which is where your energy and your metabolism and all these other pieces come into play. So doing a more thorough, comprehensive evaluation of your thyroid is going to be super important. Okay, next we're going to go ahead and we're going to look at your hormones. We're going to see how your hormones are affected by IBS. Okay, so many women will be able to say that uh, your hormones affect more than just your mood, right? If you look at your menstruation cycle for the women, unless men, you're menstruating, I get you. But for the women, we're going to focus on at this point. Quite often, you notice right around the time of your period, you end up getting a lot more cramping and maybe even diarrhea immediately surrounding it because the prostaglandins or the chemical reactions in your body to cause a contraction of the uterus also causes a contraction of the bowel. And so you quite often will get those kinds of irritable bowel symptoms surrounding your period. Women who are going through perimenopause, the first couple of years where your hormones are going all over the place, you can quite often end up with bloating or constipation or some digestion problems that just seem to pop up out of nowhere. And so making sure that we're addressing the hormone shifts so that the irritable bowel can be managed a little bit more uh, smoothly. And then women who are going through menopause as well, those lower estrogen levels can cause an alteration in the gut sensitivity and motility. And sometimes that can also create irritable bowel-like symptoms. And so if you've noticed this change in your digestion with your cycle or it got worse around menopause, it's not in your head, it's part of your hormones, and it's how those hormones are talking to your gut. Okay. Now, something else I mentioned is talking about stress. And a lot of you guys have probably been told that it's just stress, right? If you can do some stuff to calm your body down, to try and control the anxiety that you're feeling, that your gut symptoms will go away. It's something I hear every day when I talk to my patients. Okay. So the stress is a big one. And it's not to say that you are a stressful person normally, or that you have a lot of stress and that's what's causing it, or that you have anxiety. It could be that you are stressed out about this situation, right? Any way about it, stress can play a part in all of this. So the gut and the brain talk constantly through something called the gut-brain axis. Your gut actually has its own nervous system with millions of neurons, and it produces most of your serotonin, which is the feel-good drug. About 90% of your body's serotonin is um, produced in your gut. There's other ones like dopamine. There's also another feel-good drug that's also produced in your gut. Now, here's the problem. When you're stressed, your body goes into a fight or flight mode. And in that state, digestion takes a back seat because your body is thinking about run from the tiger, run from the bear, and not let's break down the dinner that we just ate. Okay. So really, we need to get our body out of this stress situation so that it can use the energy to actually digest and metabolize and absorb the nutrients that you're consuming. Okay, so stress can slow down digestion. It can also speed up digestion, or it can make the gut lining more leaky. And that's why IBS and things like anxiety or depression, or even past traumas, PTSD things often show up together um, through this stress reaction and in an irritable bowel type presentation. It doesn't mean that your symptoms are just stress. It just means that your nervous system is part of the picture and that we need to be paying attention to that as well. So let's look at hidden food sensitivities. They are a sneaky player in this because unidentified food sensitivities can perpetuate your symptoms. They can make it worse. And these are different from allergies, and they often don't show up on standard tests. Okay. And what I mean is they're delayed, they're quieter reactions that can still mess with your gut. So the first type of food sensitivity is FODMAPs. FODMAP is an acronym. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Those are all different type of simple short chain carbohydrates. They're in foods like garlic, onion, apple, wheat. A lot of different fruits have it. And these fermentable sugars can cause a lot of gut irritability, can cause gas, can cause bloating. And so you might notice right after eating some of these foods, within like 20 to 30 minutes, you start to get upper abdominal bloating. And that's because of all the sugars being broken down and feeding different bacteria in your gut. Okay. So sometimes a low FODMAP diet is going to be something that's good for you. So, like our SIBO patients, we'll talk about that in a second. But SIBO patients quite often will put you on a low FODMAP diet because we want to starve the bacteria. They're going to be eating the sugars that you are consuming, and that causes the bloating. So we want to avoid those and consume a low FODMAP diet. For others, it's histamines. Okay. Histamines are these allergy type producing cells that you react to. And you're supposed to have a lot of different stop gaps in your diet, in your body to help handle histamines. And some people are just more sensitive to them than others. And so the places that we look for histamines are going to be in leftover foods. The longer food sits out, it is left over, so it's in the fridge for 2 or 3 days, the more histamines it's going to have than when you just fresh cooked it. Things like wine or fermented foods also have a lot of histamines in them. And so we look at those types of symptoms and we do things to fix your gut and kind of suppress the histamine reaction short term while we're fixing your gut so that you don't react to foods quite as much. And you might get irritable bowel syndrome type symptoms from this, things like a headache, skin issues, fatigue, stuff like that. Okay. And then looking at gluten sensitivity, whether it's non-celiac gluten sensitivity or even celiac disease, these are both different markers that can cause digestion or non-digestive symptoms. Things like brain fog, joint pain. It can cause bloating, abdominal pain, cramping. It's it is something that you really have to make sure that you are extremely careful when avoiding gluten, because unless you eliminate it 100% out of your diet, it is going to continue to wreak havoc. Even if it's something you just have once a week, it's still going to cause problems. Okay. And like I said, we're going to talk about SIBO. SIBO stands for small intestine bacterial overgrowth. And that's when bacteria that's supposed to be in the large intestine moves up into the small intestine, and it causes IBS symptoms like bloating, gas, inconsistent bowels, could be constipation or diarrhea, depending on what bacteria ends up moving around. And research actually shows that up to 80% of IBS patients actually have SIBO. Okay. So want to make sure that that is something that's on your radar when you go to talk to your doctor, because they may not be up to date with what the research says on that. Okay. Next, we're going to be looking at the autoimmune connection. Okay. So women with IBS have higher rates of autoimmune conditions. We know that. And that's why we share this, is because the origins related intestinal permeability and the immune system dysregulation, there's quite often an autoimmune leaky gut type scenario that plays out. And so celiac disease, for example, is often misdiagnosed as IBS for years. Hashimoto's thyroiditis is another. Women with IBS are more likely to have it. Even psoriasis, rheumatoid arthritis, or early Crohn's or colitis can also show up alongside irritable bowel. And so if you're dealing with IBS or joint pain or fatigue or skin rashes, it's worth asking, is there an autoimmune piece to this? Because standard blood work often misses the early stages. Okay. And so when we talk about all these things, we want to make sure that we are addressing things from a comprehensive position, right? So as a naturopathic doctor who does functional medicine, this is the crux of what we do and why we do it and how it's different than your traditional doctors. Okay. This is really where functional medicine shines. Okay. When you're getting testing done, and your doctors come back and they say all your labs are normal, what they're really saying is we didn't look in the right places because you don't feel well. Even though these labs over here are normal, we really have to be looking at this set of labs because this is what is going to determine what's going on. The comprehensive functional piece of everything is really going to give us a better picture as to what's going on. So when we talk about your comprehensive labs, we're looking at things like a comprehensive stool analysis. Okay, this shows digestion, inflammation, gut bacteria, even parasites, and it's much more detailed than a standard medical stool test where your doctor is looking for maybe a C. diff test, or they're looking for E. coli, or they're looking at an inflammatory marker. A comprehensive stool analysis is one test looking at a couple hundred different markers to see what's going on. Okay. Then we have food sensitivity testing, whether that's IgG testing or MRT testing. And really, those are aimed at identifying delayed reactions in different foods that you're having, different foods that you might be responding to or that your immune system is responding to. So, whether it's through controversial medicine, whether it's through conventional medicine, many practitioners actually find these tests a lot more helpful because IgG and MRT are looking more at an immune system type response rather than a histamine response, which your IgE testing, which is what most of your traditional doctors are doing. Also looking at breath testing. So breath testing, something that we use for identifying SIBO. We're using it to look at different carbohydrate malabsorption or like glucose malabsorption type issues that functionally your digestive issues might be labeled as IBS, but really it's that you are not absorbing nutrients well or you have bacteria in the wrong place. And so breath testing really does come in handy. And then also looking at organic acid testing. And so organic acid testing is a reverse metabolic. It helps you to look backwards at what your body did. So it's a reversal of everything else, but it can reveal metabolic imbalances because it's different from your blood work, where your blood work is showing you what's currently in your blood. The organic acid test is actually telling you how your body used what you currently have. So you might have enough vitamins or minerals in your blood, but you're not utilizing them well. And you wouldn't know that from a standard blood test, right? You would have to see what your body did with those vitamins and minerals to actually understand. And that's what the organic acid testing does. It tells us what you did with what's in your body. Plus, it also helps to identify different nutrient deficiencies, detox problems. And then there's also a lot of different markers for gut dysbiosis, whether it's microbial imbalances, whether it's yeast overgrowth or something like that we might be looking at. Okay, and so these tests are often run through functional medicine doctors or naturopathic doctors. And then every once in a while, you'll have an integrative physician who is a conventional doctor, but understands these things a little bit to where they are able to run these tests for you as well. So make sure that you understand what these different tests are so that you can actually go into your doctor and make sure that they're getting run. So, let me go back a slide. So how do you advocate for yourself when it comes to an action plan, right? So this is what I tell my patients. Start tracking your gut. Write down your energy, write down your mood, your skin issues, your joint pain, your cycles that you're having. And often as you write things down, you're going to start to see patterns that arise over a period of time, and it will help to connect those dots. Make sure when you go into appointments that you have questions ready for them. Do your own research so you can be an advocate for yourself. Rather than just saying, I feel bad, You can ask them questions like, hey, does this really cover my thyroid? Can this be something that's related to my thyroid? Could this be SIBO? Could this be fructose malabsorption? And so understanding what the different possibilities are. Your doctors are typically trained, when you go to a specialist, they're trained for all what we call the comorbidities or the other possibilities, the differential diagnoses. What is it possibly? But they don't actually think about all those different things all the time, unfortunately. And so having a list of questions for your doctor is really going to help them to maybe hone in on something that they wouldn't have normally thought about. Okay. And then build a care team around you. There are a lot of functional doctors who will handle a lot of different things because in functional medicine, we look at things from more of a functional view, right? We're going to look at not the symptom of what's going on, but why are you actually feeling that way? Now, sometimes you also need to bring in other doctors to rule out structural problems or more complex issues than what a functional medicine doctor is going to be prepared for. So sometimes you have to pull in an OBGYN to look through some hormone things, make sure there's nothing wrong with your uterus or your ovaries or some of those other issues as you starting to go through menopause and now you're feeling a bunch of different symptoms. You might get referred out to some of these other doctors who can run traditional medicine testing to rule out the big bad stuff while we're working to get things back in order. Okay. And then be persistent. That's the fourth thing here. So if one person brushes you off, find another doc who's going to be there to advocate for you. Your body's symptoms are signals. They're not just random noises. I want you to remember that. Okay. So, with that being said, what are some key takeaway things that you can take away from this conversation here? Okay. Number one is that IBS rarely exists by itself. Okay. Look for the connections to the other conditions that are going on. It's rarely um, the whole story is rarely just IBS. Okay. Number two is thyroid issues, hormones, stress, food sensitivities, autoimmune conditions. They're all some of the most common hidden players. And so, really paying attention to your body, writing down those symptoms are going to be super important. Um, Specific testing beyond the standard blood work might be necessary. So, making sure that you're aware that there are functional tests out there. You may not know what the specific test is that needs to get run, but understanding, hey, is there a functional test that can look at A, B, and C? Okay. And advocate for yourself when it comes to that kind of stuff. And be a detective to work with your doctor. Don't expect them to um, fix every little thing about you. They're there as a um, somebody to bounce questions off of, to get answers, and to point you in the right direction. A lot of the healing, though, once you get the answers, is done by the hard work that you have to put in. Okay. And then the last one is that you need to be your own advocate with everything. Okay. Choose one potential connection that resonates with your experience and bring that up at your next appointment. Your insight about your body are valuable. And I love this quote that Dr. Walls has down here. The patient may not care how much you know until they know how much you care, right? We need to be caring for our patients. We need to be listening to our patients. And if your doctor's not doing that, you're not getting the care you need. Alrighty. So want to make sure that you are hearing this, that you are understanding this. And with that, I want to go ahead and open it up to questions. If anybody is here and has questions, I would love to hear from you.